And so inflammation is the first place where I would look at alternative monitoring strategies. An alternative is a little bit of a misnomer because it could go right alongside. It doesn't have to be one or the other. It really should be done in combination. Hi there, my name is Dr. Katrina Kax, and welcome back to the Cancer Remission Mission video series on different cancers. Today, in honor of Movember, I'd like to talk to you about prostate cancer. I'd like to address three major things. One, what can you do for support during maintenance therapy? Two, alternative monitoring strategies. Are there other things that we can monitor while going through this recovery phase? And three, body confidence. Let's address any lingering symptoms from treatment and/or from the cancer itself. So first, to address maintenance therapy after prostate treatment, we want to look at the types of medications that are generally prescribed. The first one that's the easiest and most common, it's considered the first line treatment, is an anti-androgen medication. It can have many names. There's 3 or 4 different types of medications, but the job is to make sure that we're not having cell growth and it's not stimulated by androgen hormones. The second medication, which is not considered a first-line medication, is androgen synthesis inhibitors. So their job is actually to reduce the amount of testosterone that's found in the body so that it's not stimulating cell growth or overstimulating cell growth despite not having other symptoms of cancer. So a lot of times what can happen with these patients is that even though they're on the anti-androgen medication, they'll see their PSA continue to rise, but there's no other symptoms of cancer. So that's normally when they would add this medication in. The third medication that's very new to the market and is co-used in other hormonal cancers like ovarian cancers are called PARP inhibitors. Again, not a first-line therapy, generally used also to bring down those PSA markers when just anti-androgen medications aren't enough. So talking about those markers, because those markers are really important in supporting maintenance therapy and what to do. So ultimately, the PSAs are usually monitored, every 3 to 6 months at least. And then sometimes they'll even do a digital rectal exam, which is an actual physical examination of where the prostate usually sits. There are other cancer markers that we may monitor and follow along, such as a PAP, a CA125, a CEA, an AFP, and human chorionic gonadotropin, which is called HCG. All of these combined do not give you a diagnosis of recurrence of prostate cancer, but what they can do is monitor how well your body is managing hormones post a prostate cancer treatment and diagnosis. And so ultimately, the support during maintenance therapy is understanding what these medications are doing and how they're affecting you. Because when we're lowering testosterone in the body, sometimes sex drive can go down, energy can go down, brain fog can be made worse, and there are other symptoms that we'll talk about, such as hot flashes and things like that, and what we can do to be able to support you. Knowing about these therapies and what could be happening to you and that they could be responsible for some of these symptoms is a very important first place to start. So the second question I'd like to address is, what are the alternative monitoring strategies that we can use to support patients in that cancer or prostate cancer recovery place? Okay. The first one that I highly recommend is to address inflammatory markers. Prostate cancer, similar to, say, breast cancer, can be considered part of the metabolic world on the inside. So making it so that your body is not a host for these places for cancer to grow. So inflammation is very common. And so there are markers such as a CRP or an ESR, so C-reactive protein, or sedimentation rate, ESR for short. We use these to show that if we can keep them very low, so if we can keep the CRP under 1 and the ESR under 10, we reduce the risk of reoccurrence by almost 50%, which is a huge number for those who are in that prostate cancer world, where reoccurrence can be quite high and metastatic, secondary sites can start to crop up later in life. And so inflammation is the first place where I would look at alternative monitoring strategies. An alternative is a little bit of a misnomer because it could go right alongside. It doesn't have to be one or the other. It really should be done in combination. The second one that I take a look at is vitamin D. It's very key to this component and process. 80% of patients after chemotherapy, radiation, and original diagnosis come back frankly deficient in vitamin D. And vitamin D is very important, especially if we've had to deal with chemotherapy type treatments, which lower our white blood cells and our immune system, because it can be a part of that fatigue and mood swings that a lot of people, can struggle with. And vitamin D, as we've heard, tons of people are deficient, especially in the world that we live in, because we don't always get the best sun exposure. And so understanding what your level is and using supplementation appropriately to get it to where it needs to be, and where that really needs to be in studies world, it's the top quarter of the range. So if you're doing your vitamin D tests and you want it to be in that top 25%, and so usually that's above 200 on Canadian measures for a vitamin D 25OH blood test. The third one, and the one that I think that is the most important, but it's not a diagnosis, is something called single nucleotide polymorphisms. We're going to call them SNPs for short. SNPs are pretty awesome because they are like a biochemical process, and they understand how your nutrition gets broken down. They give us indications on how your brain functions in terms of neurotransmitters, gives us an indication on how you detoxify through different pathways. It allows us to understand how the powerhouses in your cells, the mitochondria, are actually able to continue to reduce, recycle all of those nutrients that you need in order to be able to move forward. There are a couple of really important studies that have been shown to connect some special SNPs with those with hormonal cancers, including prostate cancer. And how you process your sex hormones is a part of that process. And so that means, how are you able to detoxify them? How are you able to tag them? How are you able to process them and break them into pieces? And so there are some really cool ones that we look at. And that is a whole other set of videos, because we could talk forever on that one. But that is a third strategy that I would highly recommend. It is a test that you would do one time in your entire life, other than the fact that they might add more SNPs to the profile testing, because this is a newer world that we're learning in. But most really great SNP profile tests can cover anywhere between 200 to 300 SNPs that you can look at. And there's a lot of really great medically inclined ones, especially the ones that can help with nutrition and lifestyle and functionality, to understand your vitamin and mineral levels, and also allow for you to understand more about these hormones that we're talking about. So I'd like to address now body confidence and any lingering symptoms. There are some pretty classic ones related to prostate cancer. So I'd like to talk to you more today about that. The first one is hot flashes. It's the number one symptom of men that I see come into my office that are struggling with prostate cancer after treatment and diagnosis. And it is terrible. It can impact sleep. It can impact function. It can make a huge impact on mood and daily life. And so there are actually some pretty great studies that show that there are a couple of herbs that are good at dealing with hot flashes, but also they don't increase those androgen levels, those hormone levels, and that's very, very important. The first thing before I do any of those types of treatments, which I'll talk to you about in a second, is I always make sure we have a baseline. We know where your numbers are. Are we looking at all those alternative monitoring strategies? Do we have all the blood work and baselines in order to be able to address this? Then, once we have those, we can implement some treatment. The first treatment I usually recommend is acupuncture. Acupuncture has a few studies for prostate cancer, similar to breast cancer, where you can see a massive reduction. And part of the reason why I believe that it works is because it's supporting the entire nervous system. It will recover the stressors that are triggers for hot flashes. And secondly, we can actually encourage some recovery for patients that are struggling with organ recovery post chemotherapy and radiation and cancer itself. The second thing is I usually consider herbal therapies. Now, this is where it can get a little tricky, because sometimes people are on medications and we want to make sure that they're not contraindicated with each other. But there are some pretty great studies on an herb called Romania. There's also some pretty great studies with an herb called black cohosh, and there's a third set of studies on St. John's wort. There are some pretty great studies on using SSRIs, which is another type of medication, to help reduce the impact of hot flashes on men after treatment as well. So one of those things is about reducing frequency and reducing urgency and intensity that people are experiencing those hot flashes. And so finding the strategy that's right for you is one of the most important things to do. The second thing is low energy. Of course, when we're on those maintenance therapies like the anti-androgen medication, we're stopping the development of testosterone, or we're reducing its impact on the receptors. And that can make you feel very tired. So one of the things that we do is we look at all the roadblocks. So are your red blood cells and white blood cells recovered if you had chemotherapy? And if not, we need to recover them. The second thing is we look at that vitamin D we just talked about and make sure that that level is up to par, because that's something else that can add to energy loss. The third thing is there are some herbals that we can look at that are very indicated post-prostate cancer. Two of them, one of them is called cordyceps, which is actually a mushroom, and the other one's called ashwagandha. That one we have to use with a caveat because we only use it in small doses so that we don't overstimulate testosterone for patients. And again, that's one of the reasons why we take a look at baseline lab tests. The third thing to consider is when we're on some of these maintenance therapies is bone health can be a big issue. Because we're stopping those hormones from impacting the receptors, we can increase the risk of having bone health issues later in life, especially if we're dealing with someone with prostate cancer in their younger years, their late 40s, early 50s, because they have to be on these maintenance therapies for a very long time. So we look at obviously vitamin D we just talked about, but we also pair it with K2 and we take a look at boron. And there have been some pretty amazing studies preventatively to reduce the risk of osteoporosis that can come after using some of those maintenance therapies. The other piece to that is weight-bearing exercise. And that can be super, super helpful for both the fatigue as well as the bone health. It can be challenging if we have hot flashes about finding a place to do that weight-bearing exercise that doesn't bring that up, but definitely it is one of the key components to lifestyle. So if we can keep moving forward. The last set of symptoms that a lot of people will struggle with, or men will struggle with, is lack of muscle health, right? So they'll feel like they're becoming muscularly weak, brain fog, and sleep issues, and they tend to go together. And one of the reasons that can happen is because there is, of course, that intervention in that testosterone world. And so what we generally do is we want to make sure we're addressing lifestyle changes for this. So exercise reduces fatigue, okay? And of course, we just talked about it also increases muscle mass. And the second thing is weight resistance training, okay? So it's not just going for a walk or riding your bike, but actually doing some weight resistance. That lack of muscle, brain fog, sleep issues can also be addressed by stress. So of course, men suffer sometimes very differently than women with stress, and it can come out in different places. And so I highly recommend that you consider what your hobbies are, what brings you joy in life, ways to decompress your stress, and make sure that you're doing those on a regular basis. Some of the studies I'd like to point out is that men who walked more than 3 hours a week at a very brisk pace, over 3 miles per hour, saw a 57% lower risk of prostate cancer reoccurrence. That's pretty huge than those that walked less than 3 hours or at too easy of a pace. We also were able to show that if we were able to do small fasting, it doesn't need to be intense, between 13 to 16 hours, that we were also able to see better sleep quality, reduction in reoccurrence, and better brain fog by managing that blood sugar levels. Okay, so there are lots of interventions. I hope you enjoyed our video. Come back again.